Welcome to the Alex Salmond Show, where in the run-up to the Tokyo Olympics, we focus on the greatest race of all, the contest between the vaccines and the virus. And where better to introduce the subject than outside the London Science Museum, currently pressed into service as a National Health Service Vaccination Centre, a demonstration of the practical application of scientific achievement. It now seems reasonably clear that in the countries of the UK, science has the upper hand, entirely thanks to the NHS vaccination programme. The vaccines haven't stopped the virus, which is still running rampant, but they do stop most people getting seriously unwell and keeps them out of hospital. Indeed, the success of the NHS in running vaccinations compared to the serious deficiencies of the privatised English test and trace system is something which Sajid, Javid, Westminster's incoming Health Secretary, may wish to ponder as he considers the massive issue of reform of social care provision. The UK may be in the finishing straight of beating the virus, but internationally, humankind is barely out of the starting blocks. Last month, in the idyllic setting of Carbis Bay in Cornwall, the G7 leaders hailed a worldwide initiative to provide vaccines for all. However, it was immediately dismissed as a moral failure by former Prime Minister Gordon Brown, as it emerged that it would be years, not months, before the developing world has access to life-saving vaccines. Today, on the Alex Salmond Show, we turn to the expertise of a man who knows the answers, Dr. Jerome Kim, Secretary General of the Seoul-based International Vaccine Institute. This key interview coming up soon, but first your tweets and messages in response to our show last week featuring Peter Tatchell and the film Hating Peter Tatchell. Gordon says, looking forward to seeing the movie. Peter was quite clearly 3 decades ahead of his time. Fascinating interview by Alex, thank you. Carol says, thanks Alex, quite a lot in there I didn't know about Peter Tatchell. And finally, a contrary view from Archie Young. He says, Tatchell is a troublemaker. He was at the miners' strike causing trouble. Well, the International Vaccine Institute is a Seoul-based non-profit international organisation devoted to research in vaccine development and delivery for the developing world. With 160 partners worldwide, ranging from government, industry, academia and civil society, to intergovernmental organisations such as the World Health Organization, the IVI is uniquely placed to judge on the state of the doomsday race between the deployment of vaccines and the development of the coronavirus. Will the vaccines be successful in suppressing the deadly virus, or will the new variants emerge to defeat science while the bulk of humanity is left unprotected? Alex is in conversation with Dr. Jerome Kim, Secretary General of the Seoul-based International Vaccine Institute.
Dr. Jerome Kim, give me your assessment of where the world is with this race between the vaccine and the COVID virus.
That's a great point to make now, a year and a half into this. In January of 2020, there were 3 big tasks. The first was to prove a vaccine works and is safe and efficacious. The second was to make enough of that vaccine in significant quantity at sufficient quality. And then the final was to vaccinate everyone in order to have impact, because until you vaccinate everyone, you're not going to have the right impact. So what's our scorecard? Our scorecard is we've been able to prove that 10, or actually now 13 vaccines are safe and efficacious by different regulatory standards, but by and large, that's the answer. So that was relatively simple. We did it in record time, starting from scratch in January 2020, getting to vaccines approved by November of 2020. Great. The bigger questions, though, aren't around vaccine research and development, but really around, can we make enough of this vaccine in order to vaccinate 8 billion people around the world? And then can we distribute the vaccine? Do we have the logistical system in place that will be able to put jabs into the arms of those 8 billion people? And those are going to be far more pressing questions this year and next year.
So let's look at these 3 areas you've identified. Let's look at the success first. I mean, there's now a dozen, and perhaps in a few months there'll be 20 efficacious vaccines against COVID, which will be tested and developed. That has compressed the work of a decade into a year. So what lay behind that remarkable success?
So, I think that there are a few things. The world has learned, at least a little bit, from previous pandemics when companies struggled to make vaccine fast enough, in large part because the outbreaks were over before the vaccines were developed. So a number of countries, including the UK, got together and put together something called CEPI, the Coalition for Epidemic Preparedness Innovations, which is based both in Oslo and in London. But really the point of CEPI was to say, we know that these pandemics will happen, that they could potentially be destructive and far-ranging, and we really need to have a better system. Within 3 weeks of the announcement of the sequence of the virus in January 2020, CEPI had already identified companies that it was going to fund to develop vaccines, kind of unprecedented speed for funding. But they also made it clear to the companies that they wanted a product as quickly as possible. And so they were able to pay for the research and development costs up front in order to get the countries to accelerate. And then in April to May of last year, the US government kicked in with Operation Warp Speed. Again, $20 billion of investment. Kind of the same way a country would develop a weapon, the country developed a vaccine. They said, this is what we want. These are the characteristics. We want it to be safe and efficacious. We want the US FDA in this case to approve it. And we want 100 million, 200 million doses of the vaccine at the end. So we'll buy it from you. And that kind of effort allows you to move very, very quickly through development, because you don't have to, keep turning around and reinventing things and going back. The government said we need a vaccine quickly that's safe and efficacious, and the companies did it.
So far, so good. A range of vaccine, 5 different types of vaccine have been developed. Is it going to be possible to produce the quantities required in the sort of timescale required for a worldwide vaccination? Is the production capacity there to produce these new vaccines?
So that's a complicated question, but a really, really critical one. It's complicated because if we think about a vaccine in widespread use, influenza vaccine made by maybe 24 companies around the world, in a typical year for for the typical flu season, we make 400 to 500 million doses. We've already dispensed over 2 billion doses of COVID-19 vaccines. It gives you an impression of the scale. And now we're asking these companies, the companies that have developed these vaccines, to manufacture not 400 million, not 2 billion, but 16 billion doses of vaccine. Now, if you add on that you may need boosters, and there may be variant vaccines coming, we're talking on a scale that we've never manufactured vaccines before. And it's not dangerous. It's something that has to be done. And so, as with any manufacturing process, you have to go from initial low rate manufacturing to much higher rate of manufacturing. And sometimes you have to stop production in order to retool to get even better production. So there are going to be fits and starts, and we've seen that for many of the vaccines. We also know that the vaccine companies made commitments when they were funded to do the research and development, and those commitments have to be honored because the countries that paid them up front in order to do research and development wanted the vaccine as a priority, and the companies had to fulfill that. Hopefully, we've come up with a mechanism, COVAX, that will allow access to innovative vaccine technology within the first year of development. It won't be fast enough, but it's a glimmer of hope, another glimmer of hope.
So is there any truth in the argument that some people make that the jealous guarding of effectively the vaccine patent prevent more manufacture in more places to get more quantities in a faster timescale? Is there any truth in that argument?
It's more complicated though than that, because we can give you we can say this is the vaccine. Unless you have the cookbook, which is hundreds of pages of documentation, unless we transfer that as well, you're stuck with having to develop the process yourself. The BioNTech process, now this is a report, I haven't actually seen it, has 50,000 steps. Each step has to be controlled and quality controlled. And how are you going to develop that if you're starting from scratch? So if we need billions of doses of vaccines over the next 3 to 6 months, and we do, simply waiving patent rights is not necessarily going to get you there. The time to start thinking about what to do in a pandemic with patent rights and IP waivers is actually now, but it may not affect the current wave of vaccines. This may be thinking a year or 2 years, or even for the next pandemic. It's an important thing to talk about, but for right now, we just need as much vaccine as we can get of high quality as possible.
So, Dr. Kim, let's take the third area you identified. I mean, let's say it becomes possible to get the manufacture ramped up and these 2 billion doses become more like 15 or 20 billion doses over the next 6 months to a year. In itself, would take a Herculean effort. Is it going to be possible to deploy that quantity of vaccine to the places that really need it?
Another great question. And really, it gets to the issue of how we do vaccination. So, it's really been a remarkable feat that since the year 2000, Gavi, the WHO, UNICEF, have been able to put into place programs that vaccinate 80 to 85% of the world's children against the basic diseases, what we call the extended program for immunization. Really remarkable. And it's saved millions of lives. Actually, it saves 2.5 million lives a year. That's vaccinating the children. So in Korea, the birth cohort, the number of children born every year is between 300 and 400,000. The number of people in Korea is 51 million. And you can imagine the difference between having to vaccinate 300,000 individuals and vaccinating 51 million individuals. But we know that there are vaccines that we could theoretically give to adults that would improve the quality of life for adults. And could this building of infrastructure, strengthening of health systems, strengthening of reporting systems, actually create something that would give a benefit to all countries? Now, that's going to require funding. And the IMF estimates that it's a significant amount of funding, but the return on investment could be $9 trillion by 2025.
So, Dr. Kim, given your experience and knowledge and background in terms of logistics, what is the best possible estimate of when we'll be able to bring, let's say, Africa up to a level of vaccination that will prevent more COVID variants emerging out of that continent?
So I don't think it will probably be 2022 before the kinds of vaccination rates that you've seen in the UK or in Israel or the United States are going to be achievable in Africa. And it may very well be in the second half of 2022. Again, that would be a remarkable speed for a global immunization program. Remember, it took us a decade for smallpox. So there are three potential crises. The first is a humanitarian one. We know from modeling that if there is not equity in the distribution of the first 2 billion doses of vaccine, global COVID deaths, currently over 3.5 million, could double. The pandemic could be prolonged, and no one wants that. The second argument is economic, and this comes from multiple sources, and the last one is kind of interesting. The Brookings Institute, the National Board of Economic Review, and now the US White House Office of National Intelligence are essentially saying that if we cannot provide equity in the distribution of vaccines, then high-income countries will pay an economic cost. That economic cost is estimated this year at about $4 to $5 trillion. Essentially saying what the Secretary General of the United Nations said, that no one's safe until everyone's safe. But the final one is actually potentially the most troubling. And this is a biological crisis. We know that the variants have emerged from areas of uncontrolled outbreaks, from Brazil, from the UK, from South Africa, from India, from the United States. The variants of concern are generated when we can't control an outbreak using standard preventive measures in the absence of vaccination. Failure to provide vaccine to the parts of the world, failure to understand the pandemic in certain parts of the world, sub-Saharan Africa, South Asia, for example, and failure to understand where the variants are could be prompting a crisis that may undermine $20 billion worth of investment in the vaccines that we have now that are safe and efficacious. And we cannot let that happen.
Join us after the break when Alex continues his conversation with Dr. Jerome Kim, Secretary General of the International Vaccine Institute. We'll see you then. Welcome back. Alex is in conversation with Dr. Jerome Kim of the International Vaccine Institute on who is winning the deadly race between human science and the coronavirus.
Dr. Kim, what's going on with this virus? I mean, traditionally, coronaviruses were regarded almost as Cinderella viruses, slow-moving, slow to adapt. This one is quite different. These variants are emerging with surprising speed. And of these variants, which is the one you've seen which worries you most? Which of the emerging variants gives you real cause for concern?
Yeah, that's an interesting question because I used to, at my previous lab, used to do sequencing of HIV variants. Now, compared to HIV, coronavirus variation is very small. If you imagine HIV variation as by hand, coronavirus variation, the SARS-CoV-2 variation, is like the tip of a pen, a ballpoint pen. Of the variants that we have seen so far, it appears that the Delta variant, which is the one circulating now, actually the most common version circulating in the UK, very commonly found in South Asia, appears to be more transmissible and may cause a greater amount of disease. Do the vaccines work against it? Currently, they do. It's very important to get 2 doses. And actually, that's data, the effectiveness data, actually, that came out of the United Kingdom. That it's true that with appropriate vaccination, we significantly decrease the things that matter: severe infection, hospitalization, and death. And those are the things that vaccines are supposed to do.
Wouldn't it have been expected, or was indeed expected, that as the virus became more transmissible, it would carry less punch? Hasn't that been the traditional mutation of viruses? They become more infectious, but the people who are infecting suffer less disease. Again, that doesn't seem to be happening, particularly with the Delta variant.
Yes, so, viruses. So I think actually a British Nobel Prize winner once said a virus is a piece of bad news wrapped up in protein. It's mutating in order to spread efficiently. And some of the variants spread more efficiently, like when in the very early stages of the pandemic, without a significant increase in the severity of disease. The UK variant did actually have some potential increase in severity. The Delta variant appears to have potentially be more transmissible and have greater severity. So we can't predict how these viruses are going to mutate. They're mutating on their own in order to spread. Part of the other series of questions that we have to answer have to do with, even within the countries that are vaccinated, where are there pockets of unvaccinated people? Where is there heterogeneity in the vaccination? So in the United States, there are states with relatively high rates of vaccination and significant clusters of states with low rates of vaccination. Could those states with low rates of vaccination be, in the future, the epicenter of a new outbreak with new variants? So again, the job's not over anywhere. And I think one of the things that we have learned from this particular coronavirus is that we always seem to be surprised when, in fact, we know we need to vaccinate as many people as possible, as quickly as possible, in order to protect against the viruses we know. One of the things that people don't think about, they think, well, I'm getting vaccinated, I'm protecting myself. Well, you're not only protecting yourself, you're protecting others, because when you're vaccinated, your ability to spread the virus, if you do become infected, appears to decrease. Although we don't have formal proof of that, there's a lot of circumstantial evidence around that. But the second part of this is you're beating the virus, because if we can contain outbreaks, we control the generation of mutants. So if we're going to beat this, we all have to get vaccinated as quickly as possible.
Dr. Kim, looking at your own background as a colonel in the military, your work on HIV, is this struggle between viruses and emerging viruses and humankind, is it like a military campaign? Can you think of it in that context? Is humankind engaged in an eternal battle with viruses?
I think that's a very poetic description. In fact, there have been multiple infectious diseases, not only viruses, that have been the result of introductions into human populations. And some of them will seem kind of old-fashioned. The great pox was actually syphilis. The smallpox killed, up to 30% of certain populations when it was introduced. There are islands in the Pacific that were wiped out by measles when they were introduced by Europeans. Yes, it is. There have been a series of pandemics that occur periodically. This is the COVID-19 pandemic is the worst in a century. We thought, in fact, that with modern medicine, with all of our ability to make new vaccines and to do epidemiology and to do all this molecular biology, that potentially we could reduce the impact. And I think that we've seen that it is not only the science, but the politics and the social issues that also are going to drive our ability to respond. So some countries, and you could use Australia or New Zealand, you could use Korea or others, have been successful in controlling the initial outbreaks in the absence of vaccination. Other countries have been less successful. And for those countries, then vaccines are very critical because there aren't other ways to control outbreaks. I think it's, we think of it as a campaign, but developing a vaccine, in this case, a vaccine against COVID, is something that the Army teaches you to do. And actually, it's funny, the US Army uses the same system for buying a tank as it does for developing a vaccine. We go through an acquisitions process that involves research and development, and then testing, and then low rate production, high rate production. But it's thought of as a continuum of making a purchase of something that will work to do what you need to do. And I think that was how they did Operation Warp Speed. They said, this is what we want. This is what we'll pay for it. At the end, if you're successful, if you meet all of the key performance indicators, we'll buy it. And that was beneficial. And I think that model helps.
Dr. Kim, from the perspective of the International Vaccine Institute, based in Seoul in Korea, and your membership countries, including, of course, partners in the WHO itself, if you had to issue a rallying call to the international community of the things that need to be done so that we can, to use a military term, get there firstest with the mostest, that we can actually deploy our resources effectively and win this struggle as quickly as possible against COVID, what would be the key things that you see as need to be done to accelerate our efforts?
So, and we have to do these things in parallel. While we were developing the vaccine, we should have been developing plans to distribute the vaccine equitably, putting into place the contracts. Those things are being worked on now. As vaccines are moving out of national regulatory approvals into WHO approval, into purchases and contracts with the organization known as COVAX, it's all taken time. And so the number of doses promised to COVAX, which is significant, 30% of global need, should be provided to this COVAX facility by the end of the year. But there have been delays. Maybe they were anticipated delays, many of them probably were unanticipated, but we had to have a mechanism for moving vaccines that are approved, that are high quality, and getting them into the facility so that they can be distributed. The second part of this is really around preparations for vaccination. So how are we going to ensure that when we have 1.1 billion doses for sub-Saharan Africa, how are we going to be able to ensure that those vaccine doses are going to be given appropriately to all the people who need it as quickly as possible? Are we working now on strengthening immunization systems in those countries, on strengthening logistical systems within those countries to ensure that when we have the vaccine in hand, we can rapidly put that vaccine into the arm of a person who needs it? We often say vaccines don't save lives, vaccination does. The process of vaccinating 8 billion people with probably at least two doses of vaccine, 16 billion doses, is unprecedented. But it's something that we can't fail at, something that we really have to succeed in doing. So IVI, we didn't develop our own vaccine. What we had decided in February of last year was we will help anybody who comes to us for assistance, because we can interact or we can work with companies at the earliest stage when it's still in the laboratory or when they want to test it in animals. We can test it in human populations in what we call phase 1, phase 2, and phase 3 trials. We can test it in effectiveness trials. So we can do mass vaccinations and see whether the vaccine is actually doing what we want it to do. We can work with regulatory agencies or with groups like the WHO that set policy. And many people from IVI have been sitting on committees with WHO, helping to form some of the policy around COVID-19 vaccination. So, we for COVID, view ourselves as a helper, willing to go anywhere, to do anything in order to move vaccines through the process of research and development. Now, we actually have only 4 funders, state funders, that are Korea, Sweden, India, and Finland. No G7 countries are part of IVI. Most of our funding, 3/4 of it, comes from philanthropic organizations or vaccine research organizations like CEPI, the Coalition for Epidemic Preparedness Innovation, or the Bill and Melinda Gates Foundation. So we really, or the Wellcome Trust, and we really critically depend on those projects that we have to write in order to do the work that we do. And we really do work on the diseases that the big companies don't want to work on. We're really committed to that and to the populations around the world in need of vaccination.
Dr. Jerome Kim, Secretary General of the International Vaccine Institute, thank you so much for joining me on the Alex Salmond Show.
Thank you, Alex.
Gordon Brown became the butt of much humour when once in the House of Commons as Prime Minister, he announced he was busy saving the world when he meant to say saving the banks. However, it's difficult not to accept his current condemnation of the G7 attempts to provide the world with vaccine protection as inadequate to meet both the enormity and urgency of the task in hand. As Dr. Kim points out, the creation and manufacture of billions of vaccines is a triumph of human ingenuity. But he warns that it's vaccinations, not vaccines, which save people. And the numbers of shots needed are 20 billion, not the 2 billion pledged by the G7 in early course. Gordon Brown, when an MP, represented Kirkcaldy, and out of that same Scottish town came the genius of Adam Smith, the founder of economics. Smith developed the concept of enlightened self-interest, and it is that dictum which should redirect the world's rich to the urgency and scale required to save the world. If this virus remains undefeated anywhere for any length of time, then a variant will surely emerge out of Africa or Asia, which will evade the vaccine and plunge us all back into darkness. The logistics of vaccinating everywhere on the planet needs to be tackled right now if everyone on the planet is to be safe for the future. But for now, from Alex and myself and all at the show, it's goodbye, stay safe, and we'll see you all again next week.